Up first, the World Health Organization has declared the monkeypox outbreak a public health emergency of international concern. WHO Director General Dr. Tedros Ghebreyesus says the situation has changed rapidly since the group held an emergency meeting last month.
There are now more than 16,000 reported cases from 75 countries and territories and 5 deaths.
Meanwhile, as monkeypox cases rise globally, a local public health official wants the Ministry of Health to move swiftly to acquire the necessary vaccines. Shamila Pullen reports.
Since the monkeypox virus became a global health threat, many countries have now gone ahead to secure vaccines to treat the virus. Recently, the government confirmed the first case of the virus in the island. But for public health specialist Dr. Alveston Bailey, this is just the beginning as he predicts more cases in the near future. Therefore, Dr. Bailey is calling on the Ministry of Health to start procuring vaccines early to administer to targeted groups when it becomes necessary.
For example, we know that there's a vaccine called modified attenuated vaccinia virus, and that is available, and we might want to consider obtaining a few doses of that. We also know that there is an antiviral agent known as tecovirimat that was developed for smallpox that has been shown to be effective in treating persons post-exposure.
As it relates to isolation spaces at public health facilities, Dr. Bailey says tighter measures are needed and that should be addressed urgently.
The patient should be placed in a single-person room and, if necessary, a security guard be assigned to that location. The door should be kept closed. Ideally, the patient should have a dedicated bathroom and only be taken out of the room for special medical reasons. And all those who come in contact with the individual should ensure that they wear appropriate personal protective equipment.
But Dr. Bailey remains optimistic that the government will be able to manage the monkeypox virus in the island.
This particular virus is spread through close personal contact. The risk to the larger population is low, and therefore once we do appropriate testing, once we do appropriate contact tracing, once we quarantine the index cases, I think we should be able to contain this infection as quickly as possible.
Meanwhile, Health Minister Dr. Christopher Tufton says his ministry is willing to purchase the drug, but only when it becomes available. Shamila Pullen, TVJ News.